I would like to ask you something very secret. Would you turn down a patient?
Well, yes. There are times when I would like to turn down a patient. I'll give you some examples.
Mm.
Like, there are some people whom, when you consult or when
Mm.
you talk to,
Mm.
and you realize that, they are not willing to change their lifestyle for the surgery what they're trying to opt for. Like, if I ask them to maintain a particular
They
diet,
have to change lifestyle like for this
yes, of
procedure.
course. Say, for example, you do a liposuction.
Ah.
Okay. Uh, it is never so that the fat cannot come back. The liposuction area, the fat need not come back, but somewhere else
Mm.
it can grow. Definitely, you put on.
Depends on the food that they are
Yes, depends
intaking.
on the
Yeah.
food, depends on the active lifestyle, how much they are into it,
Mm.
what kind of exercising are they into. So obviously, diet, exercise, and all does play a role.
Mm.
Another, red flag. This is what we call in our medical fraternity. They're called
Mm.
red flags. So a smoker who
Oh.
just refuses to give up smoking. I have recently turned down several patients, especially
Mm.
those whom we operate for the face,
Mm.
say a nose job or anything like a facelift or something. And if I know that they are smokers, those are the kind of patients that I would like to, turn down. I warn them, like, look, if you quit smoking, say 2-3 weeks
Mm.
before and maybe 4 weeks later, yes, we can take you up. Not that every smoker has to not undergo a cosmetic surgery or something. We have provisions. But
Mm.
again, those are not the patients that I would like to operate on directly without them cooperating for the procedure itself. But don't
50% responsibility is with the patient, like the one who is doing
Yes,
procedure.
definitely. Because we want to see their commitment to it.
Yeah,
As
commitment.
committed as we are
Mm.
as surgeons to the procedure, we want to see how committed the client or the patient is towards his or her
Mm.
own procedure. Otherwise, it's like a unilateral effort,
Yeah.
and that never
So you'll
gives
be having
results.
a session separately with the patient, like before doing
Yes,
this
good
procedure.
question. Good point over there. I personally would like at least 2 or 3 sometimes consultations if I know that this person has one or more red flags with him or her.
Mm.
So it's like, especially in those jobs,
Mm.
anything concerning the face,
Mm.
we take it with a pinch of salt because what you like today, you may not like tomorrow.
Yeah.
Yeah. So the thing is, we need to delve into the person's mind, the psyche to
Mm.
understand what he or she really wants
Wants.
and what we can deliver.
Mm.
So there has to be a congruence or some kind of a, what I can say, a match or a sync
Yeah.
between what you think, what you want, what we
Mm.
can deliver, and how you
Mm.
can maintain it.